Today we come to study Senile constipation of TCM. As we all know, chronic constipation is the most common clinic problems in the elderly. So what's the prevalence of the chronic constipation among the elderly in China? Let's first look at the data. Prevalence of chronic constipation. People over 65 years old is 20 to 25%. Overall population is 4 to 6%. Middle-aged and young people is 1 to 5%. This is an epidemiological study on the constipation in Chinese community population. The results show that the prevalence of chronic constipation among adults in our country is 4 to 6%, and it increases with age. The prevalence of elderly people over 65 years old is as high as 20 to 25%, which is equivalent to 2 to 3 out of 10 elderly people suffering from constipation. This is consistent with the chronic observation of the gastroenterologist. Geriatric constipation belongs to the category of senile constipation of TCM and has its own morbidity characteristics. TCM has rich experience and remarkable treatment effect in the constipation, and it is the dominant disease of TCM treatment. First of all, let's see what exactly is constipation and what are its diagnostic points. Clinically, a patient who has bowel movements less than 3 times per week, has difficulty in bowel movements, has prolonged bowel movements, or has a small amount of dry stools, or has a feeling of incomplete bowel movements, can be diagnosed with constipation. Among them, defecation is less than 3 times a week. Difficult in defecation is an essential point for diagnosis, and the rest are common accompanying symptoms. At the same time, it is divided into organic constipation and functional constipation according to the presence or absence of organic lesions. It can be divided into acute and chronic constipation according to the course of the disease. And chronic constipation refers to the course of the disease exceeding 12 weeks. In this course, we mainly discuss the functional constipation of the elderly. The onset of senile constipation is related to the old age physique, improper diet, emotional disorder, and feeling of external evil. Among them, aging is the primary cause of senile constipation. Elderly people's physical function declines with deficient yin and yang, qi and blood. Yang and qi are too deficient to warm and transport, and yin and blood are deficient in vigorous support, which can cause constipation. Clinically, these causes are both an important cause of constipation in old age and a cause of persistent and recurring constipation in old age. What's the basic pathogenesis of constipation in elderly? The basic pathogenesis of constipation in elderly is mainly dysfunction of the large intestine conduction and inability to breathe. The pathology can be summarized as 2 aspects, virtual and real. In fact, as early as the Jin and Yuan dynasties, Liu Wansu sums up, the secret of the organs cannot be treated. There are virtual and real secrets. The classification of virtual and real medical experts continue to enrich and summarize afterwards, and effectively guide clinical practice. Specifically, heat secrets, qi secrets, and cold secrets are true, while constipation with insufficient blood and yin and yang are false. It should be pointed out that the cold, hot, virtual and real state of constipation in the elderly can often be combined with each other or transformed. In general, the elderly are dominated by false syndromes, but it is not uncommon for false and real to be mixed. Let's take a look at which organs are related to the occurrence of constipation in old age. Senile constipation is in the large intestine, which is closely related to the lung, spleen, stomach, liver, and kidney. The basic pathogenesis of constipation is dysfunction of the large intestine conduction, from which we can know that the onset of constipation is naturally related to the large intestine. In addition, the organs of the lungs, spleen, stomach, liver, and kidney, and so on, had direct or indirect effects on the conduction function of the large intestine. For example, spleen deficiency transmission is weak, and the jaw stops breathing, resulting in the dysfunction of the large intestine conduction, causing constipation. The stomach is connected to the intestine. The stomach is hot, and the next large intestine can also cause the large intestine to become constipated. The lungs and the large intestine. When the heat of the lung moves down the large intestine, the conduction function of the large intestine becomes dysfunctional and constipation occurs. If kidney yang is insufficient, the large intestine loses warmth and is unable to transmit, which can cause constipation. It can be seen from above that in the clinic diagnosis and the treatment of constipation in the elderly. In addition to the large intestine, we cannot ignore the role of the lung, spleen, stomach, liver, kidney, and other organs. The main points of the syndrome differentiation in Senile constipation. The clinic diagnosis and treatment of constipation in elderly should be the first to distinguish between virtual and real. First, let's take a look at the real secrets. The real secrets include hot secrets, qi secrets, and cold secrets. The main points of syndrome differentiation are dry stomach, full abdominal pain, and yellow tongue firm. The main points of the syndrome differentiation of qi secretion are discomfort, abdominal distension or pain, and thin tongue coating. The dialectical key points of cold secrets are mainly the difficult of passing stone, the cold pain in the abdomen, the tongue reddish or pale, and pulse tight. The second major aspect is deficiency, mainly including qi deficiency, blood deficiency, yin deficiency, and yang deficiency. Constipation. Among them, the main points of the syndrome differentiation of qi deficiency constipation are that the stone is not dry, unable to work hard, and the tongue is pale and white. The main points of the syndrome differentiation of the blood deficiency constipation are dry and difficult, thin pulse, red tongue, thin or less firm. Yin deficiency constipation mainly manifests as dry stomach, hot hands and feet, dry mouth and dry throat, and tongue veins mainly with red tongue and less firm. Finally, there are yang deficiency constipation, The main points of the syndrome include hot stool, cold pain in the abdomen, and pale tongue with white foam. Treatment principles for constipation in elderly. Elderly constipation is a predominant disease treated by TCM according to its basic pathological characteristics of the dysfunction of the large intestine conduction. The basic treatment should be clinic in practice. Specifically, its treatment should be treated with both truth and false. In clinic practice, empiric constipation should be based on removing evil according to the difference between heat, cold, and constipation. The method of purging heat, warming, and regulating qi are used separately, and at the same time, the use of constipation products. The constipation of deficiency syndrome is mainly based on nourishing, according to the difference of yin and yang, qi and blood deficiency. The method of nourishing yin, nourish blood, replenish qi, and warming yang can be used. In addition, 甘温润肠 medicine can be used as appropriate. Finally, we need to pay attention to the fact that the elderly are physically weak for many years, and the qi, blood, yin and yang are in a state of decline. Therefore, the past method should be slowed down and soft stool. As the Ming Dynasty Zhang Jingyue said, secret constipation in all the elderly and the vain all need to examine the truth and the false, and it is not allowed to that some medicinals as 芒硝、大黄、巴豆, so that it will be exhaustive. Finally, let's review the important knowledge in this section. First of all, everyone needs to focus on the key diagnostic points of constipation in the elderly. Defecation is less than 3 times a week, and it is difficult to defecate. Second, the basic pathogenesis of constipation in the elderly is dysfunction of the large intestine conduction. Intestinal dysfunction. Its disease is in the large intestine, which is related to lungs, spleen, stomach, liver, and kidney. Finally, the treatment of constipation is based on the principle of passing down, but it should be examined clinically for reasons. In short, only by learning the etiology, pathogenesis, and treatment principles of constipation can we lay the foundation of the clinic treatment of constipation in nature stage. Today we have learned here. Thank you all.